The trend lines in Canada are not the same as the U.S. The new coronavirus is in steady decline here, but that could change quickly as people begin to travel and get together, especially if the U.S.-Canada border reopens after July 21st. Prime Minister Trudeau said today what's happening in the U.S. demonstrates the need for continued vigilance here.
We need to continue to be careful even as we reopen so that we don't lose all the significant progress we've made through some very difficult sacrifices by Canadians over the past months.
There is new data tonight showing just how much progress Canada has made in flattening the curve. Updated federal modeling shows transmission of the virus is largely under control, but with some significant hotspots. As Eric Sorensen reports, it comes with a warning. Progress could be lost if Canadians become complacent.
Of 257 new cases reported in Ontario, more than two-thirds are from Windsor, Essex. Much of the outbreak there among migrant farm workers who live in close quarters.
This COVID's not fair to people.
Ontario's premier says the province and Ottawa have mobilized more testing.
It's just a full-out onslaught down there to nip this in the butt there.
It's a sign the novel coronavirus strikes hardest where people gather. More than 30 active cases have been identified in a condo building in Calgary. More than 24 others are traced now to one nail salon in Kingston, Ontario. Nationally, in the last 2 weeks, COVID-19 cases are mostly concentrated outbreaks in blue, in Alberta and Saskatchewan, and in southwestern Ontario, the Toronto area, and the Montreal region. As Canadians have more contact at work and socially, experts say testing should be based on this new pattern of outbreaks.
Go and test people who cut hair, people who do nails, people who work in grocery stores and liquor stores. We need to be doing that kind of testing proactively, not because people look sick or think they're sick, but because they have occupational or behavioral risk.
The national trend remains promising. Canada's outbreak peaked around the end of April, but cases, along with deaths and hospitalizations, are all down since then. Yet public health officials project another wave in the weeks ahead. And if so, will it be a small one or another serious wave of COVID-19?
We expect to see some resurgence of cases. The key is to keep the number of cases small through ongoing core public health practices. We must be able to rapidly detect and isolate cases and quarantine their contacts.
Meantime, Canadian Blood Services is preparing to do antibody tests on blood donations to get a more accurate picture of just how many Canadians have contracted the virus.
You take a whole bunch of random blood samples and then you test to see how much COVID's there, and that gives you an idea of how much COVID is out in the community.
Antibody tests may show there's been a greater spread of the virus and possibly greater immunity. The more health officials can track this disease, the better our chance to contain the next wave. Eric Sorensen, Global News, Toronto.
The NHL is reporting a jump in the number of players infected with COVID-19. The league says 26 players have tested positive since voluntary workouts began on June 8th. And that includes 11 players who didn't take part in team workouts. Officials are still pressing ahead with plans to finish the NHL season despite the pandemic. They're reportedly in the process of selecting 2 hub cities where the remainder of games would be played.